Health Center 3. For these and other medical units in the diocese, Kinkiizi Integrated Rural Development Program has been soliciting for other forms of medical support like drugs and personnel from other stakeholders such as the government to ensure efficient service delivery. Overall, the project has significantly contributed to the district development agenda.
You know, as a district, we were privileged to have this program in place. It started in 2002, and we were just 1 year old as a district. We were still mean on the ground because we had not recruited enough staff. Even today, we don't have enough staff because one of the reasons why we don't attract staff easily is because Kanungu is really, really hard to reach. And even when they reach, it's finding it difficult to, have them stay. So the most important thing that they did for us was to mobilize the communities and to build their capacity, to get them ready for projects. When we are, let's say, on malaria campaign, reproductive campaign, we penetrate through those groups because it becomes easier. They are already in place, well established. We save time. Generally in the district, we appreciate the efforts and contribution they have made towards the community development, because if you looked at their program or the projects that they have been running in the district, in the whole district they have worked on 7,940 families. And if you visited these families, there's a very, very big change in terms of hygiene, in terms of food security, in terms of household income. There is a very, very big difference. They have taken their children to school. So you see a very big difference. They also tackled the area of water. There is a certain gravity scheme called Bushekwe, gravity flow scheme, that they worked on, and it helped to improve the water coverage in that very locality from 32% to 75%. Most importantly, they have an area of gender-based violence, to tackle the gender-based violence, which was very rampant in this district. So it has done a great, great, great deal.
But the journey this far has also had lots of challenges.
In some areas, you find people have reached a certain level in development. So they think we need to move them to another level, and you find that we don't have the capacity. The question of transport has been a big challenge. Our roads are terribly bad because these people have, like matoke, they have rice, but how can they move their goods to other areas where there is market? Then another big challenge, the people we've not reached come to our offices every day. They want to join KIRDP, but as I speak, we don't have the capacity to reach them at this particular time.
The fourth phase of the program is ending by the fall of 2013. Although funding for the next phase is yet to be secured, the strategies already in place can ably sustain what the project has started in the various communities.
We have the VA, Village Agent Model, whereby we build the capacity of 3 people in each community so that they are able to continue teaching these people when there would be some gaps. Secondly, we build the capacity of community members in general, because they have the skills to manage their own project. So when that person capacity has been built, he would continue doing that work. Then we have the monitoring scheme for the group management committees. They have been trained, they know how to monitor their own projects as a group. So they move around managing their own projects. We've done a lot of lobbying and advocacy. We've linked these groups with some other government organs so they can work with extension workers where there would be a need.
Indeed, a cross-section of the people can live by themselves, but a lot more need the help. For this, Kinkiizi Integrated Rural Development Program implementers plus other stakeholders in development strongly feel there is a lot more to do, particularly in those areas where the project has not yet reached.
It would be very unfortunate if they packed today. Very, very unfortunate. Because when you see what they intend to cover in the areas of water, we still have a problem. As a whole district, we are at 63% of safe water coverage. And that is not good at all. And we thought by the year 2016, at least we should be 90%. But I don't see government having enough money, at least to support our projects so that we meet our target by then. So if they could still be in place, then that would be very, very good. And then, of course, in the income, household income, we are still very, very low. We were targeting that by the year 2020, at least each family should have 10 million at least a year. And we are very, very far as that target is concerned. Because, let me give you an example of SLA, the saving culture groups. They have targeted 30,000 people in their groups. And if you compare that figure with the population that we have of 250,000 people, you see that's a very, very small percentage. So if they could at least move up to a half of the population, then that would be something that we could perhaps rely on and say we would meet our target. And then as a district, we have projects that were coming up, but we are finding it very, very difficult to fund them fully. One of them, I would say, is the reproductive health, family planning, and then we have HIV, AIDS. That is an area that we are not funding fully. And we also are experiencing a very, very big problem of malnutrition among the under-5s. The research has come up to show that the under-5s in Kanungu are really, really malnourished. Out of 10, it's very unfortunate, they say 6, as I talk now, are malnourished. That's an area we need partners to come up and really work together to fight that malnutrition in our district. So we feel this is not the right time for KIRDP to stop, because we thought we would have really an opportunity to partner with them in those projects and see how best we can improve and serve our communities better.
All God-loving people who wish to team up with Kinkiizi Integrated Rural Development Program to reach some more vulnerable people are welcome. You can learn more about the program by logging on to www.kirdp.org or contact their office on irdp2006@yahoo.com.